Hello, everyone. We'll just wait for everyone to come in. All right, well, we'll go ahead and get started. I just want to introduce myself to anyone that I haven't met yet. My name is Dr. Ashley Slater. I graduated from Oklahoma State University Veterinary School in 2018. I'm originally from Oklahoma. I then pursued equine internship at a referral hospital near Austin, Texas, where we worked on mostly Western performance horses, but we also did general practice, surgery, and took care of medicine cases as well. In 2019, I joined the Elkhorn veterinary team. So, well, just some housekeeping. Thank you all for being here tonight. I hope you have enjoyed the past two seminars, and looking forward to next week, March 17th, with Dr. Kristen Stoll talking about pre-purchase exams. So the chat will be open if you have any concerns about the video or the sound quality, let us know. And then we will hold the questions for the end, and hopefully some of the other doctors in the practice can join us tonight. So, all right, I'll go ahead and start sharing my screen here. All right, tonight I'm going to be talking about grazing strategies and the metabolic horse. With spring rolling around, it's definitely something that we need to think about and talk about. So why should we be concerned? So two main diseases that we think about are pasture-associated laminitis and colic. Pasture-associated laminitis is also called grass founder. It is a potentially life-threatening and debilitating disease. It is said to be caused by rapid fermentation of non-structural carbohydrates, which I will discuss further later in this presentation, and an increase in glucose and insulin in the blood. Colic is a term for abdominal pain in this case, and this is due to excessive non-structural carbohydrates causing disruption of fermentation and the microbiome in the cecum and colon, leading to gas and things like that. So a brief overview of laminitis, as Dr. Tucker also touched on last week. So laminitis is inflammation of the lamina. The lamina are interdigitating tissues within the hoof that get inflamed. And this is when we see potential coffin bone rotation or sinking, or the coffin bone is also called phalanx 3. Clinical findings for laminitis is lameness at the walk. It's usually both forelimbs, but I have seen it in all forelimbs with grass founder specifically. You also can see increased digital pulses, hoof tester sensitivity at the toe, and heat in the hoof. Laminitis is diagnosed based on history, clinical findings, and foot radiographs. So here I just want to go over the normal anatomy of a horse and the lamina that we're specifically talking about because it is important. So here we got P1, the pastern. We got the short pastern bone, which is P2, and then the coffin bone. And this is the lamina right here. This is the dorsal hoof wall. And this is the lamina right here in front of the coffin bone. And this is the sole, and which is also important in laminitis, and when we see that sole decrease is when horses tend to get really sore. So here, examples of laminitis, mild case. So we can see potential evidence on radiographs when this starts filling in with fluid, indicating inflammation. And then here we start seeing this is rotation of the coffin bone. You see we're starting to lose that sole depth, which is really important to the horse. And then here, again, we get pretty severe rotation of that coffin bone, which all can occur with pasture-associated laminitis. So horses affected with pasture-associated laminitis, it can be any horse, but the horses that are most at risk are Cushing's disease horses and equine metabolic syndrome horses. In both of these endocrinopathies, insulin dysfunction seems to be the key component in both of these diseases. So insulin dysfunction is defined as hyperinsulinemia and insulin resistance. So your pancreas makes insulin in response to glucose in the blood. And if your body isn't able to utilize that glucose, your body continues to make insulin, and you get a high insulin in the blood. So your tissues aren't sensitive to that. And this can include donkeys and ponies. It's similar to type 2 diabetes in humans. So here again, just a reiteration, kind of classic Cushing disease horse. We got long, wavy hair. Also, we're losing the top line, muscle wasting, and we got this pot belly appearance. And then over here, we have a crusty neck. We're starting to get some regional adiposity here, and then around the tail head as well. And you can see that this is a pretty classic laminitis stance where they're rocking back on the hind end. And I just wanted to point out they are doing a lot of studies now where they're trying to, Cushing's disease or, pituitary dysfunction, it can actually lead to equine metabolic syndrome or insulin dysfunction. So definitely need more research on that, but they are showing those two to be correlated. So here is a study that was put out in 2016 that I recently saw in one of my continuing education courses. So it's looking at the laminar pathology in horses with pituitary pars intermediate dysfunction. So in those PPID horses, it's basically showing that in these geriatric horses, you can see the ages around 16, 22, and 20 here. So PPID horses without laminitis still have a really high ACTH, which is what we measure when we're measuring to diagnose PPID. But these horses do not have laminitis in this case. They have a normal resting insulin. And then you get down here with the PPID and laminitis horses, you can see the serum insulin is very high, but we also have an increase in ACTH. It's not necessarily as high as this one, but is still elevated. So basically a summary for this, which I thought was interesting. So Cushing's disease horses with a high ACTH and a low insulin level are not always at risk for laminitis. With PPID and hyperinsulinemia together, there is a high risk for laminitis. So just something to think about, that we should be monitoring these horses' insulin levels just as much as we are their ACTH levels. So for laminitis treatment, it's really case dependent. It's dependent on your veterinarian. But the basic principles are controlling inflammation, such as this little pony is doing here. Hopefully he's got some ice in those buckets and he's icing his feet. provide sole support, plus or minus heel elevation, depending on the severity of that laminitis, and then address any endocrine disorders that are there, if applicable. All right, so we'll move into talking about grass now. So attributing grass factors to this laminitis, this non-structural carbohydrates. So you get high levels of non-structural carbohydrates in the grass. Non-structural carbohydrates are defined as simple sugars, starches, and fructans. These are generated through photosynthesis, and they are stored. They are a stored carbohydrate in the grass. The level of these non-structural carbohydrates vary greatly by grass species, environmental conditions, and then the stage of growth of the grass. So non-structural carbohydrate concentrations here. In cool season grasses, we see a higher concentration of fructans. Examples of these cool season grasses are tall fescue, orchard grass, and timothy grass. These have highest NSCs content in the spring, but we can't forget about the fall too. The fall can be a problem as well for these non-structural carbohydrates to be high. Warm season grasses are highest in starches. Examples of these are Bermuda grass, crabgrass, and teff grass. These grow best in hot summer months, and they produce lower NSCs. So NSCs change with time. They are at the lowest concentration early in the morning, between 2 and 9 a.m. depending on what paper you look at. I feel like there's a lot of different opinions or research out there about this topic. So you will likely find a lot of different answers on this, but it seems to be pretty consistent. Early morning has the lowest concentration. And then, when your sun gets highest in the day, 4 or 5 o'clock, that's when you get peak concentration. So increased sunlight, increased photosynthesis, increase in your NSCs. Grass in shady areas actually accumulate less NSCs because there's less direct sunlight, which makes sense. So temperature also affects these NSCs. So springtime, if the temperature is under 40 degrees Fahrenheit overnight, the plant will not utilize NSC stores and will have high NSCs in the AM in cool season grasses. So that probably around this time would be that for us in Wisconsin. And then restricted plant growth increases NSC. So anything that restricts that plant to grow, including frosts, decreased fertility, and drought. So here's a little chart. I kind of like to put it into perspective here, going throughout the day. Starts at 6 a.m. and then goes down to 6 a.m. and then back again to 6 a.m. So you can see here, your highest concentration is going to be around 4 or 5 o'clock, and then your lowest is going to be in your early morning, and then it continues like that throughout the day. I'm speaking really fast here. Anyways, introduction to spring grass. So there are several, obviously introductions that you can do. I mean, you can obviously make this fit for your schedule. These are just things I saw online, proposed, introduction periods. So one was begin with a 15-minute period, increase by 10 minutes every few days to and then up to 3 to 4 hour grazing period for 2 weeks. Or you can start turning out for 1 hour during the early morning, and then increase that every few days. I did note that a study in 2011 suggested that restricting grazing after a 4-hour time period, those horses actually consume the amount of grass they're kind of going to consume in 24 hours in that time period. So meaning that if anything over 4 hours, you're not really restricting their grass intake, as though they will go ham and get it all in with that time period because they know that they're restricted. So and they looked at it basically in an insulin format for that study. So hay considerations as well. A non-structural carbohydrate content is maintained despite cutting. Consider soaking your hay for 30 minutes prior to feeding for your high-risk horses, your metabolic syndrome horses. This will help draw out the sugars and the starches in the hay, and then you feed them that hay that has been soaked. Also consider feeding in a slow feed hay net, not only to keep them busy, but to help with weight loss. So management tips for your metabolic horse: allow to graze only in the very early morning. Keep your pasture mode greater than 6 inches though, because you don't want to overgraze the pasture. There are greater non-structural carbohydrates in the bottom 3 to 4 inches of grass. So it's also important to utilize rotational grazing so you don't stress your pasture. Using a grazing muzzle is awesome. It limits the intake by 80%, which is quite a bit. So it definitely could be a consideration. And then also limit your grazing time, as we talked about, 2 to 4 hours per day. And then you can test your grass and hay content as well. You want under 10 to 12 non-structural carbohydrate percent for these high-risk horses. Management tips continued. So maintain your horse's ideal body condition score. They really are showing that a regular exercise program is the best to get these horses back to an insulin sensitive state. Also, when you're selecting seeds, select for a warm season or a low NSC cool season grass when seeding. And then consider utilizing a dry lot 24/7 for these high-risk horses, especially during the spring. And then you'll want to supplement with a hay or a ration balancer during that time. And I believe that's it. These are my sources. If you would like to look at any of the articles that I mentioned in this presentation. And then at this time, we will take questions. Sorry, I spoke really quickly. We'll give you a few minutes. I know I rushed through that. I know it's a lot of information, so if you have any other questions afterwards, you can greatly send them to the large animal email, which is largeanimals@elkhornvet.com as well. So for I see, should horses diagnosed with Cushing's receive regular tests for insulin? Um, this is can be based on clinical signs of insulin resistance, but we are showing more and more that insulin comes into place, especially with these chronic reoccurring laminitic horses. So I'd say if your horse has any type of chronic laminitis or anything like that, it would be a good idea to go ahead and test your insulin on that horse. The insulin testing does require fasting for a minimum of 4 to 6 hours, but can be done. You don't want to test them in a stressed state because this can influence your insulin. It can increase it falsely. And there are other tests as well, such as the oral sugar test and things like that, just based on a case-by-case basis on what your veterinarian would recommend. All right, Sydney Berg, when using hay nets, do you ever have concern about nets causing dental issues? I could probably see where they could wear potentially the incisors of that horse down. But I think a lot of these times when these horses need these hay nets, they need them for, potentially, to keep the weight down on these horses. I don't know if Tracy, if you have any other thoughts about the dental issues with these hay nets.
Yes, I have seen that before. Depending on, I have seen some where they do wear the incisors. And
Okay.
so, oftentimes those tend to be more of the hay nets that have, like thinner, like a thinner cord instead of like, like the, what do they call nibble nets, have like thicker woven things. If it's more of like the rope type, those I've seen that where what happens is it seems like they get their incisors over that and it wears the back of the O3s on both sides.
Okay.
So if you have a horse that's really aggressive, sometimes I think that may be a concern. But you just need to find a different type of, slow feeder hay net.
Awesome. Thank you so much, Tracy. All right, Tina. So if I use a grazing muzzle for my high-risk donkey, can he be out for 10 hours a day on grass pasture? Well, for me personally, I think 10 hours might be much. I know the grazing muzzles do a great job, but I think I still would try to limit it. Obviously, it depends on the body condition score of your donkey. And then also, if he's had any history of laminitis or anything like that. But I think I would try to limit that if at all possible. All right, Faye, my horse has had IR body type ever since I purchased him 15 years ago. We've used diet as a big deterrent to onset. He does not show abnormal tests for glucose or having an active disease. Good. Diet is very important in managing these guys. So would you suggest starting with a grazing muzzle now? I think it probably depends on your grass, how much grass is coming up now. I feel like it is starting to for sure. So it would be a good consideration, especially just to get them used to it, especially with the lush grass coming right around the corner. Okay, Leslie. If the time of day makes a difference, when best to allow grazing? What time of day in cutting a hay field make a difference as well. Dr. Tracy, do you know, I bet it
Yeah,
would. I bet
the
it
answer
would.
to that is yes.
Yeah.
So, and I do have a few people that will ask that, depending on, like what kind of grasses and stuff they have. But the people who have some of these horses will actually ask what time they have cut the hay, because like Dr. Slater said, depending on the time, it's got more sugar in it. So I know I have one client who has one mare who's super, super sensitive, and she has the farmer cut her own hay, and she'll have him come out first thing in the morning as soon as the dew is off, they start cutting the hay. And sometimes he even, if it's getting too late, he just cuts it with the dew. It just takes longer to dry.
Gotcha. Yeah, that would make sense. Great questions, you guys. I see there's another one in the chat. It says, can you elaborate on the grazing muzzle? So a grazing muzzle, it looks kind of like a halter, but it has a little basket that fits around their muzzle. They make various sizes that can fit ponies or your donkey. And it has a hole at the bottom that allows for some grass to get in, but that's how it limits the intake. A lot of them can and will try to get it off. So you might have to be creative on how you try to keep it on. Some people, try to tape it even to their halter or anything like that to try to keep those grazing muzzles on. Any other questions, you guys? Well, let us know if you have any more questions. We will see you next week. Dr. Stoll, she is talking about save time, money, and heartache with the pre-purchase exam. So we'll see you next week. Thank you, guys.